TriStar Hendersonville really is a great place to practice medicine, and those kind of things really start at the top. They've got a great leadership team.
We are able to provide, through both the physicians, the staff, and the facilities we have, absolute state-of-the-art care.
As an orthopedic surgeon, I've been here in Hendersonville at Hendersonville Medical Center for 25 years. We've advanced. Things get better and better. Newer techniques, newer systems like having classes ahead of time for patients to know and understand and feel better about what they're going to go through.
When a patient comes to the total joint replacement class here, we try to get them to think ahead of the surgery. I have so many people stay around just to tell me how appreciative they are of the class that we offer here. It's just great to kind of see a brightness in their eyes, that they're happy they came, they've learned what they're getting ready to go through, and they know they've made the right decision.
Probably what I love the most about orthopedic surgery is just the ability to be able to really help people and improve their quality of life.
We treat everything from children to elderly, women and men, athletes to non-athletes. You can get an athlete back on the field, or you can take somebody that has just a hard time walking to their mailbox and give them that quality of life and the freedom back to do what they like to do is one of the things that I find most enjoyable.
One of the things that we've been working on is called the Enhanced Surgical Recovery Program. That takes many aspects into play: the anesthesiology, the nursing staff, the physical therapy, the social workers, everybody getting on the same team to work towards providing a great experience for our patients. During the surgery itself, we try and use muscle sparing approaches where we don't cut through the muscle or cut through tendon to do the surgery.
Back years ago, they would just lay in the hospital beds and be on narcotics and not moving. Now we're getting you up, getting you recovered faster, giving carbohydrate load before surgery, minimizing narcotics, doing things with blocks and spinal anesthesia that allow patients to recover much quicker, to the point where by the time they're hitting recovery room, their feet will be on the ground within an hour.
The ESR program has been very good at increasing patient satisfaction with our surgeries, getting them home quicker and safer, as well as decreasing their narcotic use.
They're going to be getting the state-of-the-art care right here in Hendersonville. My family and I live here. My kids go to school here. We go to church here, and I really enjoy being able to serve and take care of the people in the community where I live.